burden's not necessarily all on you to make fantastic change overnight.
Where you don't necessarily have that illness, but you're not really feeling a sense of thriving and flourishing and realizing your own potential either.
Oh, this person, they've got a partner, they're in a relationship, they've got a house, they've got a good job, therefore they should have good well-being. What's wrong with them? There's nothing wrong with them. They should have perfectly fine well-being. And that would be kind of imposed on people in a kind of an unfair way, because if we're talking about people who are really flourishing and thriving and really perceiving that themselves, it's got to come from the individual and their perceptions of that.
Good afternoon, everyone, and welcome back to the Mental Wellbeing Show. Today we have Dr. Phil Jefferies joining us to discuss all things mental well-being. Phil is a familiar face. He has been on the show earlier this year to discuss all things resilience, and he is a chartered psychologist, a senior research fellow at the Dalhousie University, and an honorary research fellow at the Anna Freud National Center for Children and Families. So in today's discussion, we dive into why being mentally healthy is about more than just not having a mental illness, whether we are overdiagnosing and overlabeling normal human struggles, how negative emotions and anxiety can serve us, and much, much more. If today's episode or any of the other episodes of the Mental Wellbeing Show have brought value to your life, I would be so grateful if you hit subscribe. This is how we continue to grow the show, and we are dropping episodes weekly, as well as daily short clips on mental well-being and cool psychology experiments Monday to Friday. Thanks for tuning in today, everyone, and enjoy the episode with Dr. Phil Jefferies.
Welcome to the Mental Wellbeing Show, where we take a deep dive into the wonderful worlds of psychology and mental well-being. Each episode, we dive into the evidence with a global subject expert and break down the science into applicable strategies so you can take steps to improving your mental well-being.
All right, so Dr. Phil Jefferies, welcome back to the Mental Wellbeing Show.
Thanks, indeed. It's lovely to be here again.
Yeah, it's good to have you back. You're in illustrious company. You're the first and only guest to come back so far, so make of that what you will. But we're going to be talking some very important topics on mental well-being, topics that are certainly important to me, hence the name of this show, and I know near and dear to your heart as well. So let's dive in, and the first question I'd like to ask you, Phil, is why is mental health more than just not having a mental illness?
Well, it's a great question. I think there's a little bit of history that kind of accompanies this. Like when we talk about mental health, it's still, I think, to a lot of people's minds, it's kind of like you just think, oh, problems or no problems. Like if I'm thinking about mental health, it's typically because the conversation is around people who are anxious or people who are down and depressed, and what can I do to fix that? So there's a real kind of like a problem orientation around thinking about mental health. And I think this is kind of quite historical as well. Mental health has been kind of like considered in these ways, but that's kind of changing, or at least there's a strong movement to push back against this. And it's something which is being promoted by the World Health Organization as well. Just thinking about this idea that our mental health, it doesn't just have to be either bad or fine, that having good mental health isn't just the absence of problems. And that's, that is kind of what they say in their definition as well. Good mental health is more than just the absence of problems. A bit like kind of physical health, you can sort of assess somebody's, how they're doing, if you've gone in for blood work or other kinds of scans or whatever, and somebody says, well, we've identified that there aren't these kind of problems, and you've got good levels of iron, or you've got good levels of this, but that's also kind of a spectrum as well. It's like there isn't just this sort of fine level, like people can be better than others, we can have levels of better health, and so too with mental health as well. It links to I suppose the development of positive psychology as well, and this kind of this group of sort of researchers, theorists, who were just, I guess, a bit fed up with psychology just focusing on problems and negativity, right? Saying there's got to be more to it than just identifying problems and how to fix problems. It's like, what about looking for things that are good and promoting, say, good mental health and going beyond just the badness? And that's like where this kind of approach to mental health kind of comes from, where you say, let's think about it as maybe like a spectrum. And on the one end, you've got terrible mental health, high levels of mental illness, disorders. But as you move up this kind of continuum, you reduce those and things get better. And at some point, you've got good mental health and better mental health and excellent mental health. Like it's, that was the kind of the early ideas thinking about this. So, good mental health, imagine a person who just, they feel like life is great for them. Like they're in a place where they're very happy, compared to somebody who just feels content. They just feel okay. Nothing particularly wrong with them, with their lives, with anything. They're not really struggling with anything, but they don't wake up with that kind of vigor, with that kind of energy, with like level of happiness that maybe others can have if they are further up that continuum, if you like.
Yeah, I've heard it being described as feeling blah or feeling meh, or kind of just getting on by as a kind of middle end of mental health, where you don't necessarily have that illness, but you're not really feeling a sense of thriving and flourishing and realizing your own potential either.
That's it. And those are kind of like some of the key terms that the positive psychologists were promoting, flourishing and thriving. It's, there's got to be something which is more than just getting by, more than just surviving, more than just being okay. What about people who are kind of like living their best lives? They're thriving. They're in their environment. They're doing really well. They are really happy. They've got a sense of like good purpose, those kinds of things. And that was sort of being thought about. And like I say, then you've got this idea of mental health that had developed into this kind of spectrum going from terrible to excellent, not just terrible to okay. So it extended those ideas. And then so the researchers were finding that people could almost like occupy more than one space on that continuum. Like you could have poor mental health in the sense that you could be very anxious, but you could also be quite happy. You could also report that you were quite satisfied with your life and this kind of thing, that like it seemed like a bit of almost like a contradiction at times, but this was like a kind of a common finding. And that was really drawing attention to the fact that maybe there was something about mental health where it wasn't just a single kind of spectrum going from, terrible to fantastic. Actually, maybe there were different dimensions of mental health, right? So that you could have these kind of problems, psychopathology, things that we kind of commonly associate with mental health, depression symptoms, anxiety symptoms, behavioral problems, other kind of emotional problems. And that can sort of be one spectrum. But then you could also have something which was relatively independent, which was more to do with well-being. And that's when people started to think in terms of what's been called like the dual factor model of mental health. And that's, relatedly, that's why you see so much kind of discourse around mental health and well-being. And people are still trying to figure out how to reconcile those kind of terms, but realizing that they're very kind of closely related. When we're thinking about a person, mental health and well-being, mental health probably involves well-being. It's probably like nested in there somewhere. So rather than like single spectrum, terrible to great, you've got like maybe one spectrum, terrible to kind of okay, in terms of these like symptoms, these disorder symptoms, your anxiety, depression. On the other hand, you've got something which a person can be assessed on, or you can ask yourself questions related to, how's your well-being? How do you feel, that is distinct from those kind of disorder related questions.
And it's so important, I think, to recognize from both sides of the coin, if you like, or both kind of ends of each dimension. So if you've got like someone with a mental illness, recognizing that there are still gradations of mental health that you can achieve, even within your mental illness, even whilst the 6, 12, 18 months that you still meet the criteria for depression, anxiety, whatever. And I think that that to me represents what I see with my clients is no one walks through the door and says, I'm meeting criteria for depression on the DSM, the Handbook of Mental Illnesses. It's more, I want to improve my functioning, which is relates to the mental health side of things, how I am in my relationships. I want to be able to do, certain things in my life that I can't do, irrespective of whether I still meet the 6, symptoms for depression or whatever.
Yeah, absolutely. And I think it's when you start to understand those kind of cases, which many of us fall into those kind of situations you described at some point in our lives, when we kind of dip in and out. And I guess that's another important point, is that our mental health sort of status isn't fixed, and we can jump around and occupy these different places on these kind of tools, on these models at different times. But yeah, if we are to say, and I guess this is where visual aids help, if we draw that kind of that cross, and one line is maybe your depression symptoms and your anxiety symptoms, your kind of classic psychopathology, and then you've got your other line, which is the other part of the cross about well-being, then you've got 4 boxes there. And in the one box, you've got somebody who's got maybe no psychopathology symptoms, no depression symptoms, no anxiety symptoms, that kind of thing. And they got high levels of well-being. And they're that kind of person who is classified as flourishing or thriving. And some people have called that complete mental health as well. Things that it's happy days for that person, or that time in that person's life to be there. And vice versa, in the kind of the opposite box, someone who's got some kind of depression symptoms, anxiety symptoms, psychopathology is present, and they've got low well-being, that they've been labeled as struggling or troubled. Things are pretty bad for that person. It's going to be important to intervene somewhere. You're kind of suffering on both accounts. But it's when you look at those other 2 boxes that it really kind of exemplifies what more people might identify with, especially when they're kind of looking for support. One of these kind of boxes, these kind of categories, if you like, and I'm reluctant to kind of use labels and categories, but it does help at some stage, because it helps us kind of get across what we're talking about. But for somebody who's maybe they don't really have any psychopathology, low levels of depression or none, low levels of anxiety, but their well-being is also low, that person who might be kind of called, in the literature, they get described as vulnerable or languishing. And what does that, that person, it might look like somebody who, like I said, no real symptoms of any kind of disorder as such, but life just feels a bit kind of crappy for them, a sense of malaise, not really too happy where they are in life, not really don't feel too good about themselves. And that's kind of it's an interesting thing to kind of to ponder, because that person obviously does not have the ideal mental health. They don't have complete mental health, but we're not going to necessarily treat them for anxiety symptoms, depression symptoms or something, because they don't have that. But there's something else. And that's when we think maybe more broadly, and we think, well, what are the kind of the factors that might be contributing to this? Are there things about what's going on in the person's life, relationships, living situation, and that's where we kind of start to dig into well-being, the nature of well-being, and what it actually means. We start to think, we've got to think it's not just happiness, and people have done work into this to try to break apart and understand what well-being might be kind of understood by. But then just before kind of like, in case we go on to that, I will just say the other box, your fourth box, is a kind of flip of those things then. And then you've got another interesting situation where you've got some people who they might present with some kind of psychopathology symptoms. They're kind of anxious, they're a bit depressed or whatever, something there. And yet they've got kind of good well-being, and these people have been, like, according to this model, labeled as things like symptomatic but content, with this idea that they might be presenting with these things, but life is kind of okay for them. And it's kind of a strange thing to think about, because if you think, well, if you're depressed, chances are you're going to rate your well-being as pretty low. But there are some instances where it does kind of work. Maybe you've got social anxiety disorder or symptoms related to that, and you have completely kind of withdrawn from people, from important things in your life, but like that kind of insularness, you feel comfortable, safe, you're okay with that, you feel kind of happy. Like, there's a lot of people who kind of manage symptoms, and maybe they have lived for so long with them, they found kind of coping mechanisms. And for a lot of these people, interventions would help them, but they have found their own way of kind of like getting by anyway. And it's important to recognize that. But then, in this kind of broader model of complete mental health, you'd like them to also have maybe reduce those symptoms down to minimal levels entirely. So they would kind of transfer across to having both high well-being and no or minimal psychopathology.
Yeah, and I think it's so good that it is being talked about, that these levels of mental health or well-being, irrespective of where you lie on the illness spectrum, because I can imagine it'd be quite an isolating experience if you were in a languishing kind of, as you put it, kind of category, but didn't have a mental illness, in the sense of, okay, well, what does this mean? How do I make sense of this? There's no label, if you like, and this is, I suppose, one of the benefits of a label or term, to really encapsulate what's going on, because it's not in the DSM, it's not in that handbook of mental illnesses. But what do I have? How do I make sense of this experience?
Yeah, it's like, like you say, a lot of people might not be aware of what they might be grappling with, struggling with, and it's only when they kind of come into contact with professionals that somebody will say, I've seen this so many times before, I know that it's a symptom of these kinds of disorders. But as I say, like, according to this kind of approach to mental health, like, that person could have better well-being or poorer well-being, kind of almost like independent of those symptoms. Like, it does make sense that a lot of people who are suffering from these kind of mental health disorders or symptoms related to them are going to have kind of poorer well-being, but it's not always the case. And like, well-being, I think it is important to demystify this as well. It can become a bit of a throwaway term. What do we mean by well-being? Isn't it just like, is it wellness? Is it just being kind of happy? Isn't it just sort of like the absence of these kind of psychopathology problems? But people are starting to kind of break it down and give more kind of a concrete understanding of well-being. And I think it's good that it is being thought of in subjective terms as well. So when people are assessed for their well-being, it's often in terms of like, do you feel like you've got good well-being, rather than having something imposed on them? Because externally, if we just said well-being, we'd say, well, oh, this person, they've got a partner, they're in a relationship, they've got a house, they've got a good job, therefore they should have good well-being. What's wrong with them? There's nothing wrong with them. They should have perfectly fine well-being. And that would be kind of imposed on people in a kind of an unfair way, because if we're talking about people who are really flourishing and thriving and really perceiving that themselves, it's got to come from the individual and their perceptions of that. So in terms of more subjective well-being, we can dig into things like self-rated life satisfaction. Like, how do you rate your life at the moment? Like, are you happy with like how things have worked out? Are you in a place that's kind of okay? Is your trajectory kind of like, are you all right with that? Like, how would you rate that?
Yeah.
And so there's people talk about concepts like worthwhileness and like having kind of meaning and purpose. And relatedly, it's also inclusive of emotions, okay, like feeling positive and the absence of negative emotions. So recently, so you've got this kind of constellation of constructs, things like life satisfaction, things like kind of a sense of meaning and purpose and positive feelings, kind of like a kind of a happiness, and the absence of negative emotions or low levels of that. And like together, we can get a better general understanding of how a person is kind of like how they're rating their well-being, how they're kind of doing.
In terms of, I suppose, the ingredients that make up mental well-being, and particularly in contrast to a term like happiness, that you kind of mentioned earlier, and how they can be conflated. I think of mental well-being more as a combination of the short-term positive emotions and lack of, really rampant negative emotions, combined with more of those longer-term things, like you said, the meaning, the purpose, the sense of growth. But also, I think a really important distinction you made there is that what that meaning and purpose and sense of growth is up to the individual, right? That can look like many different things for many different people. But from my point of view, I suppose it's that combination of those shorter term and longer term ingredients that constitute well-being.
I think so. And it's like, it is a bit of an ongoing conversation. It's early days. Like when we're thinking about complete mental health or the complexity of mental health and all that's involved, especially in positive mental health, then some of these ingredients, as you say, they're still kind of being figured out, or how they kind of interact, or how maybe how pivotal some might be to others. That's still sort of being thought through. But it is just, it's something. And I think it's very kind of poignant when you have people who they present, they speak to people, or they seek, say, counselors or something, just because they're not in a good place. Things are kind of rough. Maybe they can't put their finger on why, or maybe they can, but they're not presenting in the sense that they will be recommended to see a clinical psychologist or someone. There aren't these kind of depression symptoms. There aren't these kind of like behavioral issues that are reminiscent of a disorder, according to these like you said, the DSM, the big sort of psychological and psychiatric manual. So, a lot of these people, they're just thinking, why if like things aren't great for me, things are pretty poor. I'm unhappy some of the time. I'm not depressed necessarily, but overall in general, if I'm understanding well-being and I'm rating my well-being, I'm going to rate it as pretty crappy at the moment, and I want to do something about that. I think that's not just important to pick up on, because a lot of people, it resonates with them and they feel that way, and they understand it, and they see that that's part of the bigger picture of mental health. It's also kind of important because research is starting to uncover links between having very good mental health, having kind of complete mental health, and other things like academic attainment and things like that, and other kind of domains of functioning, how well you get on in kind of relationships. And they're kind of uncovering these kinds of links and saying, regardless of, even if a person has maybe no sort of psychological symptoms like these kind of anxiety, depression, what have you, it does make a difference in terms of whether someone has higher well-being or low well-being. Like, we're finding research which is saying that those with higher well-being and the absence of these psychological symptoms, they're the ones who are achieving even higher grades, doing better in terms of like in sort of work contexts as well. So finding that like it's making a difference. And so that is sort of being in different parts of the world, it's becoming an argument, especially say in schools and other educational environments, not just to screen or be aware of psychological problems like the kind of mental health disorder symptoms. Don't just look out for, say, depression, anxiety. Don't just scream for those. Be aware of this other stuff, which is what we should be kind of trying to kind of promote. And I think that kind of links into the broader idea of mental health promotion. Don't just look for the problems, look for the things that we can otherwise kind of improve, so our students can be more the ones who thrive, flourish, because we know that they'll go on to better things.
I really love what you were saying as well about just the way that people are looking at their own mental health. And I think even like if I look at over the past, say, 15 years, if I forget what the literature is looking at and all these kind of technical models and terms, I just look at like me and my friends in conversation when, we were in high school. If you were mentally not okay, in inverted commas, it automatically implied that you were having some pretty much acute mental illness. Or the kids who were seeing the school counselors, there was some stigma, but it was also the assumption of, okay, that there's something very serious going on, like this kid is suicidal or must be self-harming, right? That was the conversation as teenagers that was certainly the case amongst me and my peers 15 years ago. Now that's changed because obviously we were teenagers and didn't know what from what. But also, I'm just seeing more and more of those conversations now. People willingly saying that, what, mentally I'm just not great today. But again, it's not to say that they're going through a mental illness as such, but they're just not thriving or having that optimal mental health that they'd like, as you said.
Yeah, and that's like the fascinating thing kind of about mental health, is that we bounce around things, like our kind of position, if you like, on this kind of continuum or on this sort of dual factor model. Like you say, you wake up one day and like things feel pretty crappy, things feel pretty bad, and other days less so. Like, everyone has bad days, that kind of gets touted around. And that's important as well. It's like, don't necessarily read too much into having a bad day or a bad week if this isn't something which is kind of lasting. Like, a lot of people will emerge from this. Maybe we can put our finger on why we're having a bad day, and that's, we've got kind of something that we might be able to do something about, maybe not. But like, it might just be transitory. It might just be something where like things get a bit better for whatever reason, the course stops or like it kind of fades away, and so people kind of like, they jump around in terms of their mental health like a lot. And I get the sense that maybe well-being is more susceptible to that. Like when you're talking about, say, psychological disorders, this psychopathology, somebody's presenting with, say, anxiety symptoms or something else, then a lot of the time that's because it's pretty kind of stable. It's been this way for quite a while. It's something which they are in need of an intervention to do something about. But in terms of, say, well-being, if we're thinking about kind of life satisfaction and happiness, it's like there can be quite a lot of like movement around that, and which might be dependent on external factors as well. We recently kind of getting over kind of the COVID pandemic. Everyone's kind of locked up, and you get in the cabin fever, and then all of a sudden people are feeling pretty crappy about it. And some people made the connection why, and others just felt bad and couldn't really realize why that was the case for them. But the moment where all kind of released and things get a bit more back to normal is then people start feeling a bit better about their well-being, a bit happier, a bit kind of like, oh yeah, relationships are pretty good and that kind of thing. So we aren't kind of stuck in whichever kind of quadrant which we might find ourselves in when we wake up one day. That might move around a bit, and I think that's important as well. It's like, if you're in any kind of setting where there is screening going on, you might be kind of categorized or labeled, but that's not like you for life. That's not like, that could change due to external factors. That could change just because something else happens kind of in your life. Like, a lot of life events have big knock-on effects on our mental health.
When should people look out for mental health drops or challenges as signs that perhaps this is a little bit more than a little fluctuation that's a common part of the human experience? When does it become concerning that action might need to be taken? again, understanding that everyone's experience is individual and we're generalizing.
Yeah, it's a great question, and I think it's something which we probably don't have a great answer for at the moment. I think things are kind of clearer cut when we're talking about mental illness in terms of psychopathology and these symptoms. There are a lot of good kind of screening tools, like there are clinical assessments, which, individuals can kind of go through. And if they're being rated in a certain way, if they're scoring a certain way, it really is an indication that they need some kind of intervention. So they would need kind of support. And that would be fairly kind of black and white. And it's why things like the DSM, like it's not without its faults, but it has evolved over the decades, and it has a lot of criteria that people have to fulfill to be deemed a certain way. So, to be classed as somebody with depression, to have experienced it for a certain length of time, and to, meet various criteria. It's not just something where, well, you woke up one day and you felt down, or you said, I'm horribly depressed. It's like you've got to meet these relatively stringent criteria, and you can that can be kind of done with a tool, but then really takes the clinical psychologist to be able to make that judgment and say, this person's got this kind of mental health disorder issue, they need intervention. Whereas when we're talking about other, related constructs like well-being and how that might kind of fluctuate, and when you want to do something, I think it's kind of early days. It's hard to know. And you can imagine there being some important research studies to try to figure this out, right? Like you'd think, like I can imagine that it would be important to be able to track people over a long period of time. Maybe you're kind of going through school or other kind of longitudinal studies where you're doing these repeat assessments of somebody's mental health in terms of, say, well-being, and then you look at things that are related to that, and you look at how stable it is, so you have a better picture, a better understanding. Maybe actually somebody whose well-being jumps around the place is linked to other things like instability in other parts of their life, other things kind of going on for them. Or you might find that there are others who say they occupy the highest echelons of well-being. They've got really high well-being, and maybe for those ones where it doesn't change much, they might be associated with like some beneficial outcomes. Like they might be the ones who get kind of better grades and things like that. And it's, you look at the relationship, you try and understand that. But this is a bit of a long-winded response to basically saying, I think we need to do the studies to try to understand more about how well-being changes and the implications of those changes.
And in terms of implications, so I know you've done a fair bit of work, Phil, or at least are doing that work now, looking into the implications of this in the school setting. So can you speak to a little bit of the importance of this, in that particular setting?
Like I was involved in a big research project in the UK where they were collecting a lot of data from secondary school students. And part of this involved assessment of mental health, and they did assess psychopathology, and they did assess well-being. So we were able to get information to help us know about kind of the dual factor model of mental health to understand if somebody would have, say, complete mental health, or if they would, say, be in one of these other out of the four kind of boxes, the four categories. And I think it has important implications for schools. I think in the past and even up to now, there's a lot of focus on preventing problems, as there should be when it is kind of quite extreme. When you have psychopathology symptoms where students might be kind of suicidal, where they might be kind of self-harming, where there might be other things, like it's important to pick up on that. It's important to kind of intervene to support those individuals who might not otherwise kind of come forward anyway. So you get kind of screening efforts to pick up on those things and to understand the level of those kind of psychopathology symptoms in your student population. But I think when schools recognize that, in addition to that, if you screen for well-being as well, if you investigate that, and you can identify individuals with maybe low well-being, or you get a sense in your students of maybe how well-being is on the whole, then it's possible to intervene there, or it's an area where you might want to, because we know from the research literature that those who have higher well-being, students with higher well-being and the absence of psychopathology, are the ones who kind of get on the best. They do the best in school. So there's a lot of kind of studies and articles, stories in the news talked about in the moment in terms of, say, student dropout, student absences. This is at the university level as well as sort of the school level, and how they're being linked to mental health issues. So people are staying away from school, or they're dropping out, or whatever, because of issues with their mental health. And, when it is, say, the psychopathology, yes, we can intervene on that. But for others, where things like, these individuals are the ones who are, they're upset, they're not happy, they're not in a good place, they don't see the point, they got this, as I say, this sense of malaise, sort of, what's the point? It becomes kind of a key area to intervene, to make sure that people stay motivated with whatever kind of path they're on, to keep going, because they aren't just, say, waking up and going through the motions. You want people to be invested in themselves. You want them to be thriving, to be flourishing. And so that's where, it's not just important to kind of, that if that resonates with us, it's important to us. It's also important to these educational institutions, because they want to maximize attendance, because they want to keep students in whatever kind of, they want to reduce drop off. If you're in the universities, they want higher grades, they want to encourage that. Well, that means you've got to do something to improve well-being as well. You've got to engage in relevant health promotion activities to make it so that people do feel generally satisfied with their lives where they are. So there is a sense of happiness. So collectively, their well-being is as high as we can kind of encourage.
Yeah, and I think it's so important in those formative years, right, to be teaching people skills that they can use to augment and improve their own mental health, accessible skills that work for them, whether it's exercise, how to have, conversations when you are struggling, what signs maybe to look out for, or, skills like mindfulness, right, in those formative years, so that they can learn them then and take them with them. There's no reason they can't take them with them throughout the whole adulthood. And particularly when, psychological distress and mental illnesses start to really form and manifest in, that young kind of period, this can be really pivotal to someone's life. And if you can set them up in those formative years, you can really change the course, I imagine, of their schooling life, but their mental well-being throughout the adulthood, if they learn the skills and learn that mental health literacy at that young age.
Absolutely, yeah. It's like the sort of teenage years are often referred to as these sort of formative years, but it's not just while you're in school. It's like it's this period of life that kind of goes through to the early university days or whatever. Like, plenty of research is showing that we're still developing, brains are still developing. There's neurological development up until mid-20s. This is like this period of development that's really quite formative, can begin in early adolescence, but go all the way through to then. And it really, like you said, it's a template. It sets the stage for what happens in later adulthood. Yeah, there can be interventions to kind of course correct or to change things, but that really is when a lot of when we're kind of setting the scene for what might happen in later life. So it's tricky though. It's like you say, there's a lot of kind of skills which we can learn, and we can try things out, whether that's mindfulness or other kinds of approaches to make sure we stay mentally healthy, to make sure that we have that our well-being is kind of maximized. But we've also got to recognize that like that's a period of in life when you've got hormones and all sorts crashing around your body. It's like, I think the German phrase is like Sturm und Drang, which reflects the kind of the stormy nature of what we're kind of going through. It's chaotic, and there's got to be a little bit of like understanding of that like you're going to have a lot of bad days. You're going to feel terrible on some days, and there might be like external causes to that. There might be biological causes to that, but it's not necessarily always going to be like that or be like that for the long term. So I think going back to what we were talking about earlier, it's like let's see how things go for a while. I'm not sure whether we touched on this before, but that organization that was kind of set up, I think it was in the States, that was kind of anti-youth suicide, was very much promoting this idea of understanding that with the idea that like there will be stability that will eventually come in later life. And if I'm remembering correctly, the title of that organization was, they just put it forward and they said it gets better. That was their kind of like the catchphrase and what they were trying to put out there, because for these young people who are just suffering, thinking this is terrible, this is awful, things are bad, my well-being is through the floor, maybe there's other kinds of, there's anxiety, there's depression symptoms as well, and like things change a little bit, but they're very terrible. It was just this recognition that a lot of the time you pull through as well. Like, yes, these years can be formative and they can kind of set the stage for later life, but also there'll be some stabilizing there. There'll be some stabilizing in terms of what's going on within your bodies. There'll be some stabilization in terms of relationships, in terms of living situation. All those kinds of things promote, I guess, general stability, which is a lot of the time related to well-being, related to kind of positive mental health. So just the message was trying to reduce the incidence of suicide through focusing on that kind of light at the end of the tunnel, if you like.
I love that, and you brought that up a couple of times, this notion of it, it does get better, and that this fluctuating nature of mental health. And I can see, I mean, not to be too cynical, but I can see how this, if not done carefully and the message is not promoted in a really careful way, how this can almost become toxic. We talked about toxic resilience in our previous discussion, but if the message being interpreted is that I always need to be flourishing, I always need to be thriving, then people can get the wrong, I suppose, interpretation in terms of well, your mental health will in fact fluctuate. And I was thinking about this even the other day. I got some poor news in regards to my PhD application, and it was kind of late at night, and it just kind of threw me for a little bit. And I was just thinking, wow, this is, my mood dropped a little bit, and I just felt like, I just need to give myself a night just to, eat a little bit of crap, stay up a little bit later, just forego my routine just for one night, because I know that tomorrow, once the time surpasses, this will, the edge will be taken off a little bit. But just to kind of, I suppose, put into perspective that idea that things do fluctuate, and that we need to be careful in terms of sending the message that flourishing all the time throughout life isn't the ideal or goal either.
Yeah, it's not realistic, like to consider that you'll always be 100% flourishing, or that you should be pushing yourself for this. Like, there's a lot of messaging around just giving yourself a break. You have a bad day, things aren't going great. Well, get out the comfy clothes, just push away all the kind of commitments that don't desperately need kind of doing, and just, give yourself a break. And then, you can pick these things up tomorrow. You can pick these things up 2 days later. It's okay to kind of go through a bad spell. It's only when those are on such a recurrent basis, or they never seem to leave, that I think then that's the kind of the sign for action. And another thing, it is when we're talking about, say, well-being, like there are so many things that impact our well-being. To say or to think you should be flourishing, it puts a lot of emphasis on the individual. But like, if you have maybe poor well-being, you're rating your well-being as not so great, that might be because your family situation is not ideal at that time. There might be some problems at home. Your living situation might be bad. You might be in like a crappy neighborhood. There might be things that are sort of beyond your control. And if you find that like these things are impacting you such that your well-being is not as great as it could be, such as the fact that you don't feel that you're thriving, then the emphasis shouldn't necessarily be on you to sort yourself out, because these might be externally imposed factors, if you like. They're kind of beyond our control. There might be other things which other people in our lives bear some responsibility to do something about, or broader society as well. It's like, there might be stuff going on in your environment which needs just the government, the council need to step in. They need to be sort of kind of doing something about, or making efforts that way. So I think, like resilience, it can't all be putting the burden and the emphasis on the individual to pull themselves up by their bootstraps, and I think especially when we're thinking about things that impact well-being, it's relevant.
And on the way of environmental factors, are there particular policies or changes on a policy level, like from a national government point of view, that either are being done where you are or you've seen around the world, or that you think could make a big difference in the way of specifically kind of, mental health, and helping people to move a little bit up the dimension of mental health?
The government in this part of the world, I think there's becoming a better recognition in a broader understanding of mental health. And there are policy documents that are promoting activities in schools to go beyond just your very basic stuff to do with depression, anxiety. So helping develop that kind of emotional literacy, and helping students to understand that like healthy relationships, positive pro-social relationships will have there'll be a reciprocal impact, right? Like there'll be something about your kind of positive peer network that will come back to your sense of well-being as well. So that's kind of being encouraged in these sort of like non-traditionally academic kind of classes, or that time that's set aside, things that were, I think, I'm not sure what the exact current term is, but like personal health and social education, they were the kinds of classes where you might learn about like safer sex and drug use and peer pressure. And now that's sort of being expanded, and it's like positive relationships. There's an effort, there's an emphasis around that. It's understanding well-being, because we know these things are important as well in terms of, say, broader well-being, not just say in the concept of mental health, but in a more holistic sense.
Yeah, that's fantastic to hear that that's being done there. And I know as well, when I was in high school, again, this would have been about 15 years ago, there really wasn't much emphasis on mental well-being, even in our kind of PE, physical education classes. But having a look through in kind of preparation for our discussion, even the state that I'm in, New South Wales, where Sydney, the city, is located, the local or state government has implemented the last few years a specific exercise your mood kind of program, where it actually is teaching high school kids about the dual mental health continuum, about the fact that your mental health is explicitly more than just not having a mental illness, how to have conversations about your mental health when you might be struggling, but not necessarily having a mental illness. So I think that's fantastic to see that these things are being implemented.
It's like psychoeducation is beneficial in its own way. It's like a lot of people will be thinking, feeling these things, and then you put words and a framework around it, and it just allows people to recognize things, or say, oh yeah, that's me, but that's not me, or like, oh, that's kind of what I felt at the time. And from that point on, you get to kind of explore things like to make change if you wanted to. So it's really great that there are those initiatives like going on in various parts of the world. It's like it's just developing, right? It's like it's all all an evolution of an understanding and way to improving mental health. It's gone beyond absolutely saying nothing about mental health and like trying to play it down to a recognition that like there can be psychological problems, mental health illnesses, to now there can be like a positive area of mental health, and there can be things that we can do to kind of push people, elevate them even further, because yeah, a lot of the people a lot of the time just feel like things are pretty bad, things are pretty rubbish, and that's going to have a bearing on things that they may recognize and they may not recognize, or they may not know what they can do about it. So I think that it helps as well. Like, is that the kind of thing where you start to realize, maybe I should speak with a counselor, or maybe I should talk to family and friends about this kind of thing. It's not like I have to go see a clinical psychologist or something. Like, to some people, it's like, with my mental health and I need support, there's either psychologists or there's just stiff upper lip and get on with it. And now there's like, it helps, I think, guide people to all these other kind of possibilities, whether they're counselors, psychotherapists, who might be more kind of aligned with things to help improve well-being.
Yeah, I think especially at like a high school level, where if you hear it from somewhere else, because at that level, you're at that age, you're starting to really come out of the family network. So just if you haven't really been brought up with mental health and that kind of conversation and dialogue in the home, hearing this from whether it's a school program or from your teachers, I think can be really powerful to know that there is this concept of a mental health beyond a mental illness out there. And I think as well, like in terms of what you're saying, Phil, this stepped care model, I think that you're kind of alluding to as well, that people can learn, particularly at a young age, that they don't have to just jump to seeing the clinical psychologist. There are things that they can do in between doing nothing and seeing a psychologist to further their mental health. I'm seeing more and more of my friends and young people downloading apps like Headspace, or talking to people. I used to be in the fitness industry a lot. People would outwardly say, one of the primary reasons I'm exercising, I go to this gym, is for my mental health. So people are, engaging more in those benign interventions, if you like, to promote their mental health rather than doing nothing or going to the psychologist, like you said.
Yeah, it's like, and there's so many kind of possibilities, ranging from your kind of traditional self-help books and things like that, and people pick these things up and they try these different approaches, and with varying levels of success. The self-help industry is $1 billion, and I don't think it's always necessarily just preying on vulnerabilities and weaknesses. Like, a lot of people, it works for them and they get a lot out of it, and then obviously a lot of people as well, it doesn't do much for. And there's such an array of possible things that you might do, and it's useful to try different things, whether that is these kind of like mental health interventions that we might be self-guided, or whether that is, well, I go to the gym or I do something else, and just finding kind of what works for you, or what like a combination of approaches, and seeing how that is. And then maybe you might find that actually, like, you're not quite where you wanted to be, and you want to kind of like, you do need some other kind of intervention, which might be towards like seeing a counselor, or might be something else. But there's so many things that we can try, like you say, that are relatively benign, these interventions, whether that is dipping into mindfulness or other stuff, and it just works so well for people. But like, it's obviously, it has to be reconciled with that earlier point we were saying about, are there other things in your environment that are bogging you down, weighing you down, that you might not have so much control over? Like, if if there just aren't jobs, or that like the only jobs that you can get are these kind of crappy ones, then if all then sort of negative effects from that, that's not necessarily something that you might have a great deal of control over, and they're going to have an impact, and you can only insulate yourself and shield yourself against that for so long. You know, if I've got like a really nasty job where my boss is onto me all the time and it pays peanuts, then my mindfulness will only take me so far in terms of its protective elements, or going to the gym is only going to do something. And like, I'm still maybe going to not really rate my, subjective well-being too high. And like, that's not necessarily all on me. Like, that is just how it is until I'm able to maybe change jobs, which may come up at some point in the future. It's sort of some things, again, it's not about putting all the pressure onto people. Like, there has to be some kind of interaction or recognition that there are environmental factors, societal factors at play that might be beyond our complete control, and a fair recognition of that. So, there's always a bit of a balance, and having to recognize that we can only do so much for ourselves as well, and that's fine.
That's a fantastic point. We discussed that a lot in our previous discussion, and I think I mentioned this to you over email, but that was a huge takeaway that's really changed my own practice with my own clients, is to be mindful of loading the individual. And I work in an EAP, employee assistance program, which is where like a lot of workplace issues clients come with, and for me, it's our conversation that we had really changed my interactions with clients, in the sense that if a client is, for example, going through a lot of workplace bullying but can't leave that situation, the CBT and mindfulness and whatever therapies I take them through, I'm mindful not to load that on the individual and send the message too much that, you need to be doing these things more, and there is that external factor as well. So I'll link that in the show notes to people listening, because that really has changed my practice, and I think a lot of people can benefit.
So what do you
from what you said
actually
in that
do in
conversation.
those situations then? Like, if
So
somebody's
I think a lot
presenting
of
with,
it, I think a lot of it is getting them to understand what is in their control and what isn't, and that they can only control so much. And if they're doing the things that are in the, I call it circle of control, and things that are outside the circle of control, if they're doing the things that are in the circle of control and it's still not changing the outcome because they can't leave their job or the relationship, or they're just not ready to take that step, whatever, I think a lot of it is self-compassion as well. And for a lot of people that I see anyway, is that they're quite hard on themselves and don't perhaps feel like they shouldn't be feeling this certain way. Whereas having this objective kind of outsider can help them to realize that it's completely understandable that you're having these symptoms, that you are feeling this way, given what you're going through. You're doing everything that you can. And, what would it be like to just sit with that, and to know that the distress you're feeling is normal for someone in encountering what you're encountering.
It is really interesting. Just, I think that kind of spotlight approach of identifying things you can control and can't control is becoming more popular and appreciated. I sort of see that approach popping up in places, and also the recognition that, there are things within your control, but you may not necessarily be able to address those all straight away or in full force. Like, if you're doing a job or managing a household or whatever that's so incredibly draining, then you might have a lot of things within your control, but like, you don't want to burn out trying to fix all the things that are kind of within your camp. It's like, there's got to be a recognition of that. So definitely that's where self-compassion, like you say, is important. It's like, you can give yourself a break. You can say, well, I'll try and do these things, and maybe that'll have an impact, and maybe it won't, or maybe it's just a start. I'm starting with doing something in a way that is reasonable, that we've kind of understood is a good step, without saying, look, I can change all these things, so I should be going out there and tomorrow everything's going to be different. Because yeah, you'd probably be overwhelmed very, very quickly. So, a recognition of that as well, and that being another thing to kind of say the burden's not necessarily all on you to make fantastic change overnight.
I think and I think that ties into what you were saying earlier, Phil, as well, that the fluctuating nature of mental health, and that, I think people often do, at least in my experience in therapy, come to the expectation that they should always be feeling a certain way, and that stress and anxiety just shouldn't be there. And I think that they're for everyone, let alone someone who is having to endure workplace bullying and can't leave their job. So I think it ties full circle back to what you're saying about people find themselves in just crap circumstances sometimes, and it is normal to experience dips in mental health.
It is interesting that if you have a predisposition to not want to be anxious, to not want to be depressed, I think that's kind of fair enough. Like if we are kind of like driven to seek positive mental health, and that's not a bad thing, but it's the amount of pressure we put on ourselves to achieve that, or to achieve that kind of overnight, is just something where give yourself a break. And also the idea that we may not eradicate these things entirely, and that's fine. Like, I do some work around kind of anxiety and social anxiety, and for a lot of individuals, they appear to find it beneficial when there's some element of normalizing it as well. That, like, anxiety, there's a natural mechanism around it which can get well out of control in some cases, but in others, it serves a kind of protective effect. If you kind of think about a mechanism of anxiety, it kind of promotes alertness, it promotes you kind of being aware of your environment and other kind of actors in that space, and therefore doing something about it to kind of keep yourself safe or minimize danger. And that mechanism can get well out of control. But at the same time, you don't want to eradicate it entirely, because someone who's not, say, a bit mindful about what others are thinking about them, or a little concerned about that, is going to be they're going to walk into job interviews and be too blasé. They're going to kind of be in social interactions and not, say, as sensitive to what other people are feeling, things like that. It's like, it has its place. And it's something, I think, when you start to rationalize some of these symptoms, or to some of these experiences, and you see how they're part of normal functioning, then you don't push yourself to want to get rid of them entirely. But clearly, we do have to differentiate that from that which gets really kind of problematic, from the kind of anxiety, the kind of depression, the kinds of other kinds of issues that really intrude on our lives and impede our functioning in some capacity, whether that's being able to do our job, being able to get on with studies, being able to have very rewarding relationships.
Yeah, so important. I think these are the kinds of conversations in terms of mental health, emotional literacy, that I think would really benefit people in schools. Is just having this understanding of, what is a normal human experience, and what perhaps could be cause for concern. If you learn this stuff when you're young, this can set you up so brilliantly. Do you feel like there's anything else we could cover in terms of our conversation? We've bounced around a lot, but yeah, how do you feel?
Yeah, I suppose it was mentioned just briefly, but the idea of like labels and categorizing is maybe something to just consider as well. Like, someone comes in, there's some screening tool, like maybe you do it yourself online, or maybe you're a student in a high school, or maybe you're a university student, and something is imposed on you, like you're encouraged to fill this thing in, and they say you've got a score of 40% on the well-being measure, and you've got a score of I don't know, 80% positiveness on your kind of psychopathology assessment. So that means that, like, you're falling into a languishing kind of category or something like that, So they give you a label, they explain what it means. And there's, with a lot of these kinds of things, there is the danger of internalizing these labels as well, and then saying like, oh, well, I'm languishing, what did I do wrong? Am I a languisher? I wish I wasn't a languisher. And like, it's part of having, a way to understand things, having kind of a conceptual hook, being able to understand what's kind of maybe going on in a person's life, or where they might be relative to somebody else. But it doesn't have to kind of like, we do have to make sure that students or other individuals don't just say, well, that's me for life or whatever, or like, I'm a languisher according to this, and therefore I'm never going to achieve something else or be like something else is. For starters, there's always the possibility to move around these models of mental health to change things, and they might change naturally, like we've discussed, through things going on in life, and they might change with interventions as well. So you're never, complete mental health, entirely positive mental health or very strongly positive mental health is not kind of off the table for anyone. It's always possible. And all of us will probably find ourselves in one of those other kind of quadrants, one of those other kind of categories at some point. And it can just be useful with those kind of categories, with those labels, just to kind of pick up on those kind of issues. Just so you might say, well, maybe there's something that can be done. Maybe there's something that maybe I can do. Maybe there's something that somebody else can offer me that will help improve things for me. Or I just maybe recognize that there is the potential to improve. Like, really kind of going back to what we were talking about at the start, for those people who struggle with symptoms, but they're content, for they have a sort of like a good level of well-being despite having these kind of symptoms, then they sort of, that can be something which is recognized, and they say, well, I didn't even realize, like I just thought these behaviors, that was just normal, that's what everyone did, or I thought everyone thought these things. And it can just be a kind of almost like a mechanism to improve things even more for that individual, so that's just a kind of an awareness of like the pros and the cons of labels, essentially.
I feel like, particularly in schools, any kind of screening or assessment of, mental well-being from languishing to flourishing should come with like a very clear, not warning, but, descriptor that these are fluid, these are dynamic, you aren't set in this category, like you said, for life. You can change, and here are ways potentially to go about that.
Yeah, it's an important first step. If we start kind of embracing these kind of approaches, we're going to have to tweak how we go about administering, intervening as life goes on. But I think it's a positive first step, isn't it? That we're not just trying to focus on these kind of tangible or typically well understood mental illness issues. We are focusing on the fact that there is grades of positivity, and that we can really help encourage people to get to those top areas of where they could be, actualizing their potential in that way, and all the benefits that come with that, so it's early days, but it's an important first step in our kind of evolution of our understanding of mental health, which we have obviously a long way to go with, and how we implement activities, interventions, and do something about improving our mental health.
On that note, I want to research nerd out a little bit with you here. I've heard a lot of like slack been, or a lot of criticism been kind of thrown the way of particularly positive psychology, Martin Seligman's work, that it's kind of really just creating a whole new field or subfield of psychology for that is on shoddy science, that is really there with ulterior motives for fame of certain people, financial benefits, right? Do you get any sense of this with the mental well-being, models, or do you worry that it could go down that way, that we start to create these new labels? Because obviously there are people who did benefit from this book, podcast, self-help courses, whatever that can be made out of this stuff.
Absolutely. I think, we have to kind of be cautious that science is not objective in these kinds of areas. It's like in the sense that it isn't just this thing which is devoid of human motivations and egos and money and all sorts. Like you've said, there are people, proponents of positive psychology, who become very famous, who become very rich, as have, say, psychologists and researchers in lots of other areas, whether that is in terms of like mental illness and things like that. But yeah, Martin Seligman and some of the other positive psychologists, they have really sort of like they've become very famous and very well known in research areas, partly because there wasn't too much focus. So when they went off and said, like, let's not just focus on problems in psychology, let's focus on, all these things to do with positive human experiences, that they became pretty famous because they were one of the first to do it, and there weren't that many people going about doing that. As I say, I think that's kind of what happens a lot of the time when you get these sort of like sub-disciplines emerging or new directions or something like that. But over time, I think things kind of work themselves out a little bit more. Like we get the kind of the space and the time to reflect on things like the dual factor model of mental health and say, is it valuable? Like, is there something tangible to this which is beneficial to people to know about this, to think in terms of mental health in these ways? And I think we're kind of at the stage where that probably is the case, where we're starting to see these studies, this research, which is not conducted by those original proponents of positive psychology being done and saying, hey, look, people with complete mental health are the students who are the ones with the better grades and that kind of thing. So we are starting to see there being some like validity to saying that these things are important and they're worth focusing on. And, although some names will be associated with certain approaches and models, it's not copyright. These are ideas. They aren't like, you can't like patent these things. You don't have to, pay someone or invoke their name every time you approach this way of thinking in terms of, say, mental health. So I think definitely in the early days, there are egos, there's money, there's politics, there's vested interests, and you have to kind of think cautiously about it. But like as things grow over time, I think you get the time and space where those criticisms can kind of come out, and you can maybe figure out some of those kinds of problems. But then the actual products do get to be judged on their own merits. You get to say, look, actually, no, that's not actually, we're doing this research and we're not finding links between, say, higher levels of well-being, lower levels of psychopathology, and these other sort of functional domains. So maybe we need to rethink this, or maybe it was a load of rubbish, or maybe it was just somebody who was trying to put something out there to big up their own research career. So I think, we've got a broader kind of conversation about the nature of science or social sciences, where I think things are necessarily becoming a bit more collaborative now anyway. Like it's getting to the point where research papers, where these findings, these ideas are put out there, they are becoming far more collaborative. You are seeing far fewer of these kind of projects which have one name there. It's like this team developed this. So then that's kind of, and then you get like lots of teams that kind of work with different individuals at different times. And it becomes far more of a kind of a collaborative approach, which kind of keeps it safer from somebody who was trying to kind of push their agenda or, only promote things which aligned with their kind of approach, and a lot of other stuff, as I say, about the way that we go about doing research in the social sciences, trial registers, before we embark on our empirical study, we've already said what we think we'll find, and we've registered that so that then when we do our research and we get our findings, we're held accountable. Like we can't dig up some surprise findings in some different area because we didn't say that we were going to look for those. And also in those kind of specific hypotheses and tests, what were the outcomes? Did we not find something? Did we find something in the opposite direction? Did we actually find that things were completely on its head? And like, can we account for those like potential differences? And a lot of, journals are being encouraged to accept these null finding papers, if you like, where you didn't find what you expected to find. You said, we think there's going to be this link, we're going to go out there, we're going to test it, and we did find that, or we didn't find that. And in the case that we didn't find that, that is an interesting finding in itself. It's not something where it shouldn't be published just because there was no significant result, if you like, just because there was no, the hypothesis wasn't being upheld. So that's like, that really is sort of, I think, more widespread, not just in terms of mental health, not just in terms of positive psychology. That's a sort of a sign of the times of doing research in social sciences now, which is, there's plenty of issues, like related issues, other issues. But I think I'd say after spending this much time with, say, something like the dual factor model of mental health and thinking about mental health in this way, I personally don't see it as something which is someone's concoction to get out there and sort of become famous. And it's something which is like away from the reality. I do think that it has a lot of important, that there is validity behind it.
Yeah, like you said, it's early days, but I'm certainly looking forward to seeing, more of the implications of this model with more and more studies being done, particularly like yours, or the longitudinal one that you're doing. Are the findings going to be out soon, so myself and other research nerds can have a look at? Or
Yeah, it's so I mean, I won't take credit for it because this is it's a very big project involving a lot of researchers in the UK, and it's being driven by the Anna Freud Center. So they do a lot of work intervening to support young people, especially who are struggling due to things like poverty, other kind of social societal factors. So it's their big study of which I had the privilege to kind of collaborate and explore some of their data. So that is kind of an ongoing project where they are doing some important research in schools to understand how students get on over time in terms of, say, their mental health, in terms of their levels of psychopathology, levels of well-being, and lots of other related kind of constructs related to, say, resilience and performance and that kind of thing. So it's a very long and ongoing study, but I think that's the important thing. Like you said, longitudinal, we get to see links over time, what is predicting other things, rather than just saying these things are associated, and we don't really know the direction of that kind of effect. We don't know whether, getting good grades makes a person feel happier, or like, having a high level of well-being does something which facilitates the ability to achieve grades. Like, that's the kind of the idea, but like being able to actually tease that out is something which these longitudinal studies will hopefully help to achieve.
fantastic, Phil. This has been, a real pleasure to dive into a very fascinating topic, and I think we did it justice and made it applicable, and did it justice from the evidence, but also applicable to people who may not have much technical knowledge in this area. So thank you for sharing your time and wisdom today.
Yeah, thanks for having me again.